Okay, well, good afternoon, everybody, and welcome. I'm joined today by Dr. Priya Suaris, who is a consultant anaesthetist and is also a director of a company called Salubritas. Have I said that right, Priya?
Yeah, Lubritus.
Subritas. Well, can you explain the name? What's it?
It means Latin for health and well-being.
What a great name. Wow. Yeah.
What?
Yeah. Well, I just, except I made a mess of it because I didn't actually didn't pronounce it properly. And I did practice as well. So that's terrible, isn't it? Anyway, Priya, do you want to just introduce yourself a little bit for our viewers?
Yeah, okay. So my background is basically in anaesthetics. I've been a consultant anaesthetist for 15 years or so. My specialist area has been head and neck cancer, ENT, and sort of difficult airways. And so recently, within sort of the last 3 months, with COVID emerging, it's seen us all working in slightly different ways. We've obviously all cancelled our elective operating, and we're now working and redeployed in intensive care units, and working, doing head and neck cancer procedures, which are high risk procedures in terms of aerosol generating, and with COVID around. So basically, over the last few months, I've just been researching ways really just to keep myself safe within that work environment. And also with my husband, Tom, who's a dentist. He obviously is now at the moment unable to work. And we're just thinking about how to get him back to work in a safer way as possible, but without breaking the bank. I mean, we're obviously already, facing a difficult time financially. So, it's just about, we're just trying to work out sensible ways to do that.
And you've actually made quite a bit of progress, and you have created what I think is a fantastic new, heavily modified patient journey, because obviously that is one of the biggest concerns that is hitting all dental practices. It's not just the fact that they've got to create it from scratch almost. It's the lack of guidance from anybody really to tell them what to do properly. And I suppose the other aspect, which is a bit harsh, but is a reality nonetheless, is the cost of it. How much is it actually going to cost per treatment? So I know you've done quite a bit of work developing this new patient journey. Would you just like to talk us through it?
Yeah, okay. So, well, the background to that really is just that looking at dentists and infection rates amongst dentists, I think you're already doing a really, really good job. If you look at the headlines and in terms of who's spreading COVID, who's catching COVID, who's dying from COVID, there's there's obviously a regular roll call of doctors and nurses in ITU and that sort of thing that are dying, dentists don't appear to be on that list at all, really. And obviously we've all been practicing with it around for at least, probably a couple of months, maybe more before the lockdown. So it's interesting to see that, actually, well, how come, there isn't more sickness? Anecdotally, it's a small industry. We'd all know someone who would be sick by now with the amount of contact that we have with patients. So why is that? And I think that obviously massive reason why is that we're really already very good at cross-infection control, and some of the things that all the processes that we have in place are doing a really, really good job of protecting us already. So in terms of the pathway, what we've basically done is basically to look at some of the sort of the weak spots around that and just to tighten them up a bit, so that you're reducing the risk a little bit more every time you move through the patient pathway. I think it's almost impossible to completely, negate the risk whatsoever. But with the process we have in place, I think we can get there or as near as possible. And obviously, there's the other thing is there's an inordinate amount of information, I think, coming out in terms of all the things that advertising from people about this, that, and the other. It's coming at us. It's a barrage. and it's like way too much to absorb. So it's really just about sort of let's just break down the pathway, see what little simple things we can put in place, and maybe some other, you know, bigger ticket items which go that bit further in the process, and then see where we are. I mean, obviously the caveat to all of this is that probably at some stage it's got to be endorsed by somebody high up in the medical and dental world, you know, world, whether it's the chief dental officer or the BDA or whoever. But I think it's about opening up the conversation to people, and giving dentists back a little bit of control over how they go forward with this. So the pathway essentially starts right at the beginning with uh, so screening our patients. So if the doors open tomorrow and you've got incomplete patients who need to come back, you've got dental emergencies who are ringing on the door, you've got you've got crowns to fit, whatever, and there people want to get on with that because they don't want to stop for COVID. Actually, they do just want to get on with that. So the first thing that we need to do is to contact those patients ahead of time. And I think screening is going to be a really big part of making sure that we don't have infected patients coming through our doorway. You know, the biggest, no dentistry, I can't think of anything really that would need to be done that couldn't be delayed for a few days at least if someone was sick. So I think that's the first thing we do. So we call our patients, we give them at least about 5 to 7 days ahead of time so that we can talk to them, discuss that there are things going on in the practice in terms of slowing down, you know, the process, making it safer for them, making it safer for the dentists and the staff, and so that they are aware that this is going on, because that's a big part of it's about making your patients feel comfortable getting back into your dental world as much as making your staff and yourself comfortable. So we've got to do that. So there's a little, and then that's an opportunity as well to ask them about how they've been through this whole time when they've been in lockdown, whether they've been exposed to people who've had COVID, if they've had it themselves, if they think they've had symptoms, you know, or you know, they might even have had people who close to them who have died. So it's actually quite useful to know that, and so that when they come in, you know, some big life events going on. So the screening is really important. And one of the reasons it's important is because what happens when we get sick with COVID is that initially there's a phase where we don't know, we're just brewing it, we don't feel unwell. And as we're brewing it and not feeling unwell, our viral load is increasing slowly. So that means that the amount of virus you're breathing out of your body and coughing onto people, it is slowly increasing. And at the point at which you start to get symptoms, that's and up until the most severe part of those symptoms, that's what it's increasing daily, sort of thing. So that period of time is a crucial period of time when we're talking about viral loads. That we want to avoid our patients being in our dental area if possible. The reason being is that obviously if you see lots of patients day after day after day who are coughing and sputtering virus on you, before you can develop symptoms as a dentist, you've got a lot of virus coming into your system, and then therefore your immune system may become actually quite overwhelmed, and that's when you get really sick and, you know, end up with a pretty severe form of disease yourself. So you want to protect yourself from that time, which is why we say call your patients 5 to 7 days. Then you can tell them if they do develop symptoms in that time not to come into the surgery, or to call. And that also means that if they do develop symptoms, you can maybe slot another patient in, or, you know, you don't have massive great big holes in your diary. So you've got a bit of time to play with that. Okay, so viral load is a big thing. And also, obviously, you know, when we're talking about aerosol generating procedures, if you've got a high viral content in your airway, that's potentially going to aerosolize when you're drilling, what have you. So that again puts you at more risk. So that's important. Yeah. So screening is a really important part. And then the next part of my protocol is antibody testing. And the reason antibody testing is it's because actually, so there's a variety of different sorts of tests out there. And in the UK, basically the UK government is using PCR testing, which is polymerized chain reaction testing. So what they do is they take a swab from a person who thinks they're infected, and they take a swab, it's usually from the mouth, and they send it off to a lab for a couple of days. It takes a couple of days for the results to come back, and they're looking for virus on that swab. So if you're infected and it comes back positive, we know that you're infected and you should then self-isolate.
Yeah.
Having said that, there are inaccuracies around that, because if you are asymptomatic, you won't necessarily present. Also, your viral load, as I've said, is just starting to climb, so you might not pick it up on the swab. So it does give you a few false negatives as well, and they're not that accurate. They're maybe sort of 50 to 70% accurate, these swabs. So and there's a lab time, and they're expensive, and they take time. So and the other sorts of tests are antigen tests, and they also tell you if you are currently infected. So these two types of tests tell you if you're currently infected. They don't tell you if you've had COVID in the past,
Right.
and if you are now immune. So antibody tests tell you that. So they tell you if you think you had a flu-like illness 4 weeks ago, they will tell you if that flu-like illness was COVID, because they're picking up the antibodies to COVID. There's a bit of bad press around antibody tests. And actually, obviously, like with any other test or anything in the market, it's about making sure you've got the right test. So, and a good test, because if a bad test is worse than no test at all, actually, I think. So having a good test is crucial. We think we found a good test. So what we do with the testing is that after we screened our patients and we've said, okay, come on in, you're good to fly. On the day of their treatment, they'd come in maybe half an hour before their treatment, and we would be able to do one of these tests on them. And they're basically finger prick tests. They give you a result within 10 to 15 minutes. And they will tell you if your patient is immune or not immune. And somewhere in the middle, they can also pick up if a patient is infected or, currently trying to get rid of a virus, but not quite yet immune. So the tests can kind of differentiate the patient into various different categories of risk, basically. So if you've got a patient who's currently got no symptoms but thinks they've had COVID, and their test says they're immune, then actually I think you're in a good place, because you can then say, okay, this patient is good to go. We don't have to take as many precautions as we would when a patient who we didn't have that information on. Which when we go on from that to think about what other things we need to do, such as PPE and all those other things, that actually does make a difference to the way we treat them later on down the line.
What you're saying is that and correct me if I've got this wrong, that the advantage of using a test is that it creates a kind of fork in the road as to what degree of PP3 you might need to use. You might need to use, fairly light or medium or really heavy duty.
That's exactly right. And so, at the moment, all we have is you've got to use heavy duty on everybody.
Yeah.
Well, it's kind of just not practical, and I don't think it's necessary either. So it just gives you some kind of risk stratification that you can then you've got some sensible ideas going forward with this patient journey.
So in your business, in this new business that you've set up, so you're able to advise, if I owned a dental practice, you'd be able to sort of say to me, look, here's the protocol we recommend.
Yeah.
And you presumably got that illustrated in some way so you could explain it. But also, are you able then to supply the various elements in there? So can you supply these tests?
We can supply the test, and one of the reasons that we've opted for this test is because it's a very good test, but it's also got some software on it that's got a mobile application, which means that you don't need a qualified immunologist or doctor or someone who's got some idea about what these tests actually mean to deliver the test results. So you can get a nurse to do the test, and it's a pinprick blood test. So it's very straightforward. And she can then take a picture of the test result. It beams up to the lab's cloud in the sky, that beams back the result with the advice around what to do with that test result and what it means. So it takes a lot of the thinking out, because actually, you know, you're already going to have to dedicate a nurse probably to doing the testing. But then if you're also going to have to, you know, drag a dentist or someone out to look at the test every time, it's just manpower and people, and you know, so that's what we really like about it. We're also in the process of talking to software management companies about integrating this into their software management, so that you've got a record on your database of all the patients that you've tested. And the nice thing is you can keep track of who's immune, who hasn't yet had an immune test. If those people who haven't had an immune test subsequently get unwell in the next, you know, whatever, next time they come back in, they get another test. And if they then have turned, you know, have now become COVID immune, because then you can then, you know, change that on your database. So you can keep track of how your patient population is moving through with this disease in its population. And I think that's really important, because it's all very well to get a national statistic about we've got 10% herd immunity or 50% herd immunity, but actually what you really want to know is what is your exposure as a dental practice in your population. Is it, you know, is it a high risk population, or is it something that's a lot lower risk? So I think it's a really good thing to keep track of your own patients.
Very good. It's an obvious question that everybody's going to want to know the answer to. How much is the test? How much are you selling the test for? Presumably there's a minimum number.
No, there's no minimum number. So we have the tests are very affordable. They're £12.95. You get them in a box of 10. And so, and they're for medical use. So they're not tests that you can hand out to patients through letterboxes, or they have to come to you to get the test done. If you buy a big amount, so sort of 5,000, they go down to £10.95. We've really, and the lab as well, we've really wanted to keep it at the lower end, because we would like people to be able to test everybody that they come into contact with. You know, so this is, if you're talking about, you know, the cost of PPE versus the cost of a test, well, if you think about the average amount of PPE you might need for one patient, which is for the dentist, for the staff, and potentially for a runner outside as well, you're talking about, you know, £50 to £60 worth of masks and everything else, which I think, you know, actually it more than pays for itself if you're going to not have to use that.
Brilliant.
Yeah.
Okay, Priya, that was absolutely really helpful. Can I just check in with you that your company does supply PPE as well? Is that right?
There are issues about getting PPE, and you know, on lots of these dental forums, you have to see, it seems to be that if you want to buy them, you have to buy them in such vast quantities that it's just, you know, you'll never need that much, or you have to kind of get together with a group of other practices, and you know, split the cost. But we've got a contact who can do it in smaller amounts, so we can get that PPE. So yeah, so definitely we can. I mean, what we aim to do is, in terms of, if you come to us, we will explain how the testing works in terms of the workflow, the throughput of your patients. Yeah. We would try to provide the sweet spots for, you know, where you can put the extra protection in. So there are other things that we, you know, obviously that we haven't touched on, but you'll want to continue to maintain really good hand hygiene. You might want to change your mouthwash over from the chlorhexidine that's now used to something that's going to kill virus. So do that routinely. I think that's what I would recommend for all practices, just in this, while COVID is around, just to switch up. Just things like shoe covers. And then when you're talking about PPE, it's all very well to say, okay, we'll put, the whole point of personal protective equipment is it has to protect you. And so you have to put it on in a certain way, and you have to take it off in a certain way, because otherwise you don't get the protection that it affords, because you just contaminate yourself on the way when you're taking it off. Yeah. So it's really important to do that properly. And so there's advice around that. So we can advise you through the whole process. Or you can just buy tests, or you can just buy PPE, but you know, whatever. But we're you know, with the expertise is there for whatever you need.
And how do my clients contact you?
Well, so we've got a website. I mean, this is actually that's like we've actually been in business for about 4 weeks. But we've
Yeah,
got a website, we've got a number, you can call us. We're going to have some advertising out soon, and hopefully I'll be able to give you the numbers and details. You can put them on an
yeah,
email,
yeah.
John, and
And I think that if anybody's got difficulty contacting you, they can.
the UK. They are from a Swiss.
Whoops. I'm just saying, if anybody wants to contact me, I can pass on the
Over
information to
Europe,
you.
America. Yeah,
Sorry, just say that again. You just
exactly.
broke up there. Sorry, Priya. Could you just say that again?
So we've got a supply of tests that are available to us in the UK that we can distribute.
Yeah.
But equally, if you're buying in bigger amounts, they can send them. The lab can send them direct to Ireland or wherever you might want to buy them from, Spain,
Okay.
Italy, around Europe.
Brilliant. Priya, thank you very much. Thanks for your time.
Yeah, absolute pleasure.
All right.
Okay.
See you later. Take care. Cheers. Bye.
Bye.